From thinking about the next normal to actually making it work. Question is, how do we move forward? How do we connect with our patients and our clients in this new norm? I am Dr. Cesar Serra, Chief Operations Officer of Beyond Dental PH, Philippines' first smart dental clinic. Today, my dear colleagues, let's relax and have like a little TED Talk. Let's talk about how to attract and how to engage with our clients beyond barriers. Welcome to Dentistry Beyond the Norm.
For my 2-year-old, maganda sana siguro kung maging best friend niya yung dentist.
Kasi typical mga kids, they're afraid of dentists.
Well, my visit to my dentist was like every year. It's kind of like having a toothbrush or whatnot. It's kind of fun there. Can't miss it.
Ever since I was young, my mom always wanted to provide the best with me, especially when it comes to my teeth and smile. So like, ever since I was a baby, she took me to the dentist, even I wasn't a year yet. And I continued to visit that dentist for every 2 to 3 months, just to keep my teeth healthy and nice.
Busy mom like me would sometimes forget to put on her makeup. But I think the prettiest thing that you can wear is a smile. And a perfect makeup for a woman like me is my smile.
A fast-paced and busy lifestyle is not a reason for us to take for granted our dental health. Easy digital access to a dentist is a must for me and my family.
I'd be honest, I'm super scared of dentists. Like, it's one thing I super hate doing, I super hate going to dentists kasi past experiences and all that. But for me, the best experience when it comes to like going to a dental clinic, of course, I'd like something na very comfortable and very convenient. That's 2 things na I always consider. Of course, with the reception and everything, I want it to be welcoming. Siyempre, yun yung first thing I want when you visit a place na for you, for example, for me na may past experiences. Just gusto mo na comfortable and someone na friendly and then welcoming to you. And of course, gusto mo ng clean place. That's one thing. And yung mga past experiences ko kasi medyo like hindi siya ganun kaganda. So, gusto mo ng friendly environment and a clean space. And yun, it's very important sa akin yung smell. Na parang gusto ko malinis, ayoko ng medyo amoy gamot, yung mga ganun. And of course, convenience because all of us want fast service. Kasi syempre, all of us are busy. And for me, lalo na sa akin kasi I have a lot of meetings and all that. And medyo mainipin akong tao. So, best experience for me is that I get the same quality for a faster service.
Okay, in the new normal, dapat ang isang dental clinic ay kumpleto sa gamit, lalong-lalo na sa monitoring ng temperature ng pasyente at yung kanilang sterile area. Kaya importante yun. At the same time, yung PPE ng mga dentist kailangan kumpleto, and also yung pasyente dapat naka-PPE rin.
So in the new normal, I'm looking for dental clinics that have strict safety procedures and protocols in place. I don't care how many steps there are, I will comply with them because I know that as long as they're that strict with me, they're the same way with everyone else. So they're trying to meet that safety standard in their clinic talaga, and I won't have to worry about it. And also, I'm looking for clinics that are more into technology, I guess, because you need a lot of new technology to usher in the new normal. It's not the same way anymore, and I think it's gonna be a long-term solution to all clinics, all establishments even. So I don't mind paying for extra as well, diba? For those teeny steps for safety, kasi mas mahal pa if my health is compromised.
Going back to our question, how do we move forward? How do we connect with our clients in this new norm? The first video shouts the answer, the voice. of our customers, the voice of the clients, the voice of our patients. We heard about convenience, comfort, speed, but quality service. We have already established our practices to be hyper-personalized. We listen to what they prefer. We listen to what they ask from us. Hyper-personalized or hyper-personalization has always been there. Then COVID came. Distance is back. What will distance now do to our practices that have been based and have been established on hyper-personalization? How do we now connect in an era of disconnection? We sustain the connection that we have built with our patients by still listening to their voice. And from their voice shouts these key points that would connect us with them beyond all barriers. Let me present to you, my dear colleagues, the 3 key points of connecting with our patients in this new norm. Let's start with the first one. Recalibrate strategies. Then, after we plan it out, we recalibrate all our strategies in the clinics, we rebadge our solutions to attend to their needs. After we rebadge or we relaunch those solutions, we reshift their perspective. Let's go to the first one, recalibrating strategies. So we redesign, we rethink. In this new normal, in this new era, the shift of customer demands, the shift of situations, we still go back to the basics. Let's go to the anatomy of client engagement. It's a basic formula, and even though the shift is evolving, this anatomy of client engagement is never changing. And it goes like this. People get attracted to experience, and experience attracts people. Again, people get attracted to experience, and experience attracts people. Funny as it may seem, we think that promos, giveaways do attract them. But what retains, what stays in them is the experience. So today, we're going to talk about how to recalibrate those strategies to incorporate this patient experience. Speaking about customer experience, we are now migrating from a simple customer service, from a sheer customer service, to actual patient experience. What does that mean? To shift from customer service to customer experience. It's the way our customers or our clients or our patients evolve from their needs being served to what they experience throughout the journey while their needs are being served. That's the difference between customer service and customer experience. We have been too focused on giving service. We are a service industry, we are a service rendering industry. But what stays? What makes them return is the customer experience, and that's the root of patient attraction. It's the way they talk to you, it's the experience they felt, it's the warmth that they felt while they're having their oral prophylaxis. It's the experience that we give them while their needs are being served. Experience is still demanded in a world of COVID. Amidst all these safety protocols. And that's how we'll recalibrate. When we lay down all our cards and we recalibrate our strategies, we go back to being in their position. What could take away their fears? What could take away their worries? What makes them comfortable? What makes them come back to us beyond all the barriers that we have? We already know that when they see everything up, when they see acrylic shields, when they see these PVCs, plastic covers, it causes them fear. as a service that we need to give them out of safety. But how do we shift that fear into experience, into a feeling of security? That's number one. So while we are recalibrating our strategies, we go back, we listen. What could take away their fears kaya? What could take away their worries amidst all this? Then next, we create a storyboard for our patient experience. After thinking, oh, this plastic cover would make them feel worry, would make them feel fear, but at the same time, it would kind of make them feel safe. So might as well just put it there. What if you add a little spice? What if you add a little story? Add a little experience to that? How do we turn that service of safety into an experience of safety? Then third, we add value to our features. So it's not just a simple plastic cover. We add value to that. So, my dear colleagues, I'm going to show you a simple example of how we shifted or how we changed that worry into an experience of security. Kasi if you really think about it, I had patients who first went in the clinic and parang gulat na gulat sila. Ang daming plastic, ang daming cover, nakakasakal, nakakatakot. Ano ba to? Meron pa silang term, Dok, bakit parang nasa ospital ako? So when I was recalibrating my strategies, paano? Baka hindi na sila bumalik. Even though they feel secured, nasasakal sila. And I have to still give that service eh. But I added a little spice. How do I turn that service of security into an experience of safety?
Alexa, turn on disinfection pod.
Okay, disinfecting the pod now. Please stay inside the disinfection pod for 10 seconds until fog has stopped. Thank you for entering the disinfecting pod. Welcome to Beyond Dental.
So, through that, we were able to address, number one, the fear of patients with all these barriers. Second, their feeling of being deprived of space kasi nasasakal sila of all these plastics. Pangatlo, yung lagi nating naririnig na question, bakit kailangan namin mag-PPE? Why do we have to pay for PPE? So, we got tired of explaining already. So, we rebadged our solutions. And with that, we turned all their questions, all their fears into an experience. When they enter, they actually enjoy it. It's like a ride in an amusement park. So they get excited. They hop in the disinfection pod, they call our virtual assistant, and suddenly may makita silang fog. So it turned into a story. So from complaints, from fears, we were able to add that spice and turn their customer service into customer experience. And after that, we started rebadging our solutions. From recalibrating strategies, we are now ready to launch our solutions. So when we tried to rebadge our solutions, we started buying, di ba po, sa inyong mga dental clinic, we started buying and set up our safety features. We have the thermometers, we have the fogs, some even have huge disinfectant machines and air purifiers and all that. But it would only remain as a feature if we do not create an experience out of it. So, how do we get our patients excited with this feeling of safety, with this feeling of security? Not just looking at it as a safety feature. Meron yan si doktora, meron din naman sa kabilang doktora yan eh. Meron din naman si ganito. So, how do we shift that? How do we avoid the questions of, why are you charging me with this? Sa ibang doctor naman, may ganyan din sila. Because there is a shift from just giving customer service to customer experience. And that's the solution we are trying to relaunch. That's the solution we are trying to rebadge. Bottom line is, when we rebadge our solutions, we do not market our safety features. We market the safety experience. Even in the videos that we put, even in the ads that we put, even in the way we communicate with our patients, the way we rebadge our solutions to them. We do not tell them that, oh, we have this HEPA something, something, something. Instead, we give them the experience that they want. We let them experience them from themselves. It's like telling a story of their dental journey. So here I'm going to show you how we relaunched our safety feature, taking away their fear, giving them the sense of security through the Beyond the Norm campaign. So that was the relaunch video that we did when we relaunched our strategies for client engagement in this new normal. If you look closely into the video, it's simple. Foot-controlled alcohol, our patients could say, meron din naman yan sa iba. Sensor alcohols, our patients could say, meron din naman yan sa iba. If you put UV box, meron din naman yan sa iba. But if you dig deeply into it, it's the psychology behind it. The way we put music in our video. The way we put music in our content. There, we decided to put something aggressive, something upbeat to counter what the world has been saying about the risk of dentistry. The world has been targeting us to be highest risk, unsafe, and that really contributes to the way our patients think about us. Na bakit ako pupunta sa dentista, risky dyan. I've heard a lot of that and I'm sure kayo din, doctors, you have heard that. So we selected something welcoming. So even in the music that we select when we relaunch our strategies, it has a big impact to our patients. Even if you have a simple content, but the story that you put behind it would really contribute to how they perceive you. So yung video, yung music pa lang, so it tells you something na come here, you're safe here, ready kami. And the way the doctors placed their goggles, how they acted, it's like telling the patients, we know this, we are ready, and we are capable. So, that was the response to the problem na hindi kayo dapat pumunta sa dentist kasi delikado dyan. Hindi kayo dapat nag-visit kasi highest risk dyan. Dyan kayo mahawa. So, that's how we counter it. So, that's how we bring back that communication with our patients. And we use digital marketing to communicate. That's going to be our communication line. We need to bring that communication back. We need to make our presence felt, and we need to create visibility. And the only way now for us to do that distance is back, is through digital marketing. So we really need to know how we tell our story, how it impacts even the simple content that we have. Huwag po kayong matakot if you can only take a video of a small UV box, but if you have a story of what that UV box is for, it would create something. It would steer something different in the eyes of your patients, of your audience. So we do not sell the feature. Rather, we sell the experience that they can get with that feature. We do not sell, meron kaming UV box, meron kaming thermometer, meron kaming disinfection fog. Because everybody can have that. What's going to be the difference? It's the story. It's that experience that they feel when they encounter that. And that's how we relaunch our solutions. As we continue to bring back that communication line, and as we make our social media presence and create visibility, there are 3 content that we can utilize for our advantage. Number 1 is the content to build our brand or to rebuild our brand. As we continue to rebuild our patients' confidence, our patients' perspective, we can post content such as our personal stories, like the one video example that I showed you a while ago of how to relaunch your brand, how to relaunch your practice in the new norm. Second is, if you would want to grow your audience, that could be viral posts and giveaways. But if you ask me, the third content is the most important. The content to convert. The content to reshift their perspective. And that is result and testimonials. Also known as your patient or your client experience. After recalibrating our strategies or making our game plan, we relaunch or rebadge our solutions, and we utilize our social media content. We now go to the last one, shifting perspective. The power to convert your patient's perspective from being negative to positive. The challenge now is, how do we convert that fear into trust? I've noticed a lot of businesses thriving in this new norm as they have started to offer contactless, touchless, and tech-driven transactions. And I was thinking, how do we adapt that to dentistry? How do we thrive in that perspective for our dental industry? Thinking about contactless, touchless transactions, it's hard for us. There are a lot of you saying that dentistry or dental clinics, dentists have the closest proximity to patients. So how are we going to do that contactless and touchless transactions? That's when I thought of using AI to reshift the perspective. Yes, prophylaxis, doing crowns, doing ortho is impossible to be contactless. But there are a lot of work processes in our practice that we could shift to contactless and touchless. That's where our BID Alexa experience came in, and how AI has contributed in shifting that fear into security, in highlighting the safety features as experience, and how it shifted customer service into customer experience. I hope you enjoyed this video.
Alexa, play Netflix.
Here's Netflix.
Alexa, play YouTube.
Here's YouTube.
Alexa, what's your device name?
The name is Device 2.
Alexa, call device 1.
Calling Device 1.
Hi, patient is ready.
Okay.
Thank you. Alexa, cancel. Alexa, make an announcement.
What's the announcement?
Treatment room is ready. Please send patient.
Announcing.
Treatment room is ready. Please send patient. Alexa, thank you.
You bet. Enjoy your afternoon.
Alexa, room 1 appointment.
For treatment room 1, you have one patient for veneer cementation at 10 o'clock in the morning for Dr. Sess. At 1 o'clock in the afternoon, you have a scheduled patient for oral prophylaxis with Dr. Rebecca. At 3 o'clock to 5 o'clock you have two patients for adjustment.
Alexa, room 2 appointment.
For treatment room 2, you have one patient for Dr. Cat at 1 o'clock in the afternoon for pediatric consultation. At 5 o'clock in the afternoon, you have a scheduled patient for root canal with Dr. Andrea.
Alexa, open info about Beyond Dental teeth whitening.
Whiten your smile up to 8 shades in less than 1 hour. Get noticeable results with a safe and gentle procedure done by a dental professional. It's a fast yet effective procedure that gives you immediate results. For more information, please see brochure provided at the reception. I enjoyed being your guest today. My boss Kevin and Sess are out, so it's my time to shine. Alexa says, a new dental experience is waiting for you. See you at Beyond Dental. Don't forget to subscribe.
To us, Alexa is more than just a feature. We shifted in making AI as an experience rather than a feature. Because technically everybody has the ability to integrate it in their work processes. So what we did was to make her part of our patient's journey. Make her part of our patient's experience. Hindi man natin kayang gawing touchless ang oral prophylaxis, hindi man natin kayang gawing touchless ang ortho dahil impossible po talaga siya. But the feeling of the patient not needing to touch those lights when they go to the restroom, not needing to touch that disinfection pot as it would be part of their story or their journey is gonna make a difference in them. So it's utilizing that feature and turning it into a story. That's why to us, it's more than selling a feature, but it's creating that experience. And in this video, I'm going to show you how it made an impact to our patient even at the last touch point before they bid farewell.
Disinfection for 10 seconds until clock has stopped.
Alexa, turn on disinfection pad.
Did you mean misting machine?
Yes, that's right.
Okay.
Thank you.
Before we bid farewell and before we end this short talk of ours this afternoon, let me share with you this key takeaway. Reroute from selling the feature, but rather offer the experience. Let us continue to create stories of dental journeys that will keep them engaged amidst fear, uncertainty, and adversity. Features are very easy to sell, but the experience that you leave with them will keep them coming back to your practice. May we continue to thrive in this new norm and engage with our patients beyond these barriers. Mabuhay po ang dentistang Pilipino, and God bless